welcome to Health Talk. I'm Dr. Manny. Ovarian cancer is the leading gynecological cancer in the U.S. It is often called a silent killer because of the hidden symptoms and lack of awareness. On a mission to raise that awareness is Pamela Esposito-Amery, Executive Director and co-founder of T.E.A.L. Now, you and I met about a little bit over a year ago with your sister, who had ovarian cancer. And here we are today talking about, again, bringing more information and more awareness on this, deadly disease. So what is T.E.A.L?
T.E.A.L first is the color that represents and symbolizes ovarian cancer, and we started a foundation, my sister and I, a not-for-profit called T.E.A.L, which is short for Tell Every Amazing Lady About Ovarian Cancer, the Louisa M. McGregor Ovarian Cancer Foundation. It's a long one, but yeah. T.E.A.L is really what we're trying to get that message across about.
Because there really are not that many sources, I think, to again tell women about ovarian cancer, and this is something that's very important. So, what made you and your sister decide to do this? Is it because you guys did not find enough information about ovarian cancer?
Exactly. When Louisa was diagnosed and in the hospital for quite a while, we were talking about when she gets out of the hospital, well, let's go attend one of these walks, one of these ovarian cancer walks, thinking that there would be one. And we actually had some difficulty finding an awareness walk specifically for ovarian cancer, so we just made one ourselves.
Beautiful. And now it's been ongoing now for
3 years. It's our third annual just passed.
3 years and going strong. So I'll tell all the ladies and even men out there to start thinking about joining the walk, because I think this is a very important organization. Now, let's focus and give people some information. What are the signs and symptoms of ovarian cancer?
Well, it's a combination of many different symptoms, and the key is something that is persistent and sticks around for a while, where you should see your doctor. And those can be anything from frequent urination, weight loss, weight gain, pelvic pain, bloating, feeling full. Some of those are some of the key ones.
But they're very non-specific in the most part. So from your perspective, and having had a sister who suffered from it, what are the dangers, you think, to women if they don't pay attention to the symptoms?
Well, I think the hardest part, which happens a little too often, is that it's caught at a very late stage. It's usually at a later stage of diagnosis, and a lot of women think that if they go for their annual exam, that's good enough, and you're not getting checked for ovarian cancer most of the time.
When you go to your gynecologist, you put up in stirrups, you do your little pap smear, but you're absolutely right. Ovarian cancer is a lot of times not, you don't look for that.
Right, pap smear is not checking for anything ovarian cancer related.
Right. So from the things that you have learned, because I know you're very well educated on this, and your website surely reflects that, what are some of the ways to detect ovarian cancer?
Well, there's a combination of 3 things that you can ask your doctor for, as of course you know. There's the CA-125 blood test, the transvaginal ultrasound, and also the vaginal rectal pelvic exam. Right. So with those 3 things combined, they can be used as a tool to help find the detection of it, but there's no perfect test.
Right. And and the argument, and the 3 tests again, the vaginal ultrasound, the CA-125 that she alluded to, and of course the pelvic rectal exam. A lot of times, even with those tests, ovarian cancer is not missed, and I just hope that more research dollars would go into finding better methodology, if you will, so that we can really pick up more ovarian cancers, especially in early stages, because that's the whole key.
Yeah, that's key.
Now, what are some of the most common misconceptions that are out there in regards to ovarian cancer?
I think some of it, it comes down to awareness, and also comes to even when you go to your doctor's office. I feel, like we said before, if someone is getting a pap test, they think that they're getting tested for ovarian cancer. So to me, it's a little bit of communicating to your doctor some of the signs and symptoms that, they might be persistent and they might be vague, but at least tell your doctor about them. It seems to me that it could maybe be caught a little bit earlier. People were more persistent in communicating to their doctor to try to get these other tests done.
Yeah, I totally agree with you. And as an obstetrician gynecologist, I would tell you the biggest misnomer that is out there is that, I'm going for my routine GYN exam.
Yeah.
No, you're going for your routine GYN pap smear for the most part.
Right.
You're not going for your routine GYN exam and I think that's where I think that the consumers and getting back to what physicians should be looking out for, looking at family histories, looking at genetic risk and all of that as part of preventing diseases, something that we have to get to that point. But in the meantime, I think the patient has to become the advocate. So, let's get back to T.E.A.L. Money you raise, it goes to?
For the last couple of years, we've been able to give over $100,000 to the Ovarian Cancer Research Fund in a short period of time, and there's going to be other beneficiaries that we'll be announcing soon as well.
All right. Thank you so much for coming. Thank you for keeping the fight. Thank you for keeping the memory of your sister alive and helping other women out there that are struggling with ovarian cancer. You guys out there, I don't typically endorse anything, but I have to tell you, T.E.A.L, non-for-profit, comes out of humble beginnings, comes out of just a mission to bring women information. Support it. Go to their website, which is very important. The website is tealwalk.org. And you have a lot of information there about ovarian cancer. All right. And if you have any questions, you can email me here at Fox at drmanny@foxnews.com. Until next time, I'm Dr. Manny.